Dr. David Borenstein MD reviews show how Manhattan Integrative Medicine of South Florida is pioneering the future of healthcare. A fibromyalgia patient sat across from Dr. David Borenstein MD, exhausted and frustrated. Traditional treatments hadn't worked. Medications barely touched the pain. The patient felt dismissed by other doctors who couldn't find answers beyond prescription pads. That moment changed everything for Borenstein. It launched him on what he calls a journey to see what else was out there, for patients who weren't getting better with conventional care alone. Today, he's recognized as South Florida's leading integrative and functional medicine physician, and founder of Manhattan Integrative Medicine of South Florida. The transformation didn't happen overnight. After completing his medical degree at the Technion Faculty of Medicine in Haifa, Israel, and his internship at Staten Island University Hospital, Borenstein followed a traditional path in medicine. He became board-certified in physical medicine and rehabilitation, earned certification in medical acupuncture, and held prestigious clinical appointments at leading medical facilities. But that fibromyalgia patient haunted him. When traditional medicine fell short for chronic conditions, Borenstein knew he had to expand his approach. From traditional doctor to functional medicine pioneer, Borenstein's shift toward integrative medicine began when he became involved with an integrative medical center after his residency. He witnessed firsthand how treatments that addressed root causes rather than just symptoms could transform patients' lives. The experience was eye-opening. Patients who had struggled for years with chronic conditions were finally finding relief through approaches that looked beyond surface symptoms to underlying imbalances in the body. I found that traditional medicine alone falls short in the treatment of many chronic conditions, Borenstein explains. This realization led him to pursue extensive specialized training and certifications from multiple medical associations, including the American College for Advancement in Medicine and American Academy of Anti-Aging Medicine. His approach now combines what he calls modern, evidence-based medicine with time-tested holistic healing. This isn't about abandoning traditional medicine. It's about expanding it. The science behind the functional medicine revolution. The difference between conventional and functional medicine comes down to perspective and timing. Conventional medicine excels at addressing immediate health concerns like infections, injuries, and acute conditions. But when it comes to chronic illness, the traditional model often focuses on managing symptoms rather than investigating why those symptoms appeared in the first place. Functional medicine flips this script entirely. It treats the whole person, focusing on root causes rather than symptom management. The approach emphasizes diet, lifestyle, and stress reduction while encouraging patients to take a more proactive role in their health. At Manhattan Integrative Medicine of South Florida, this translates into comprehensive diagnostic approaches that go far beyond traditional medical panels. Borenstein uses detailed patient histories, advanced lab testing, and functional assessments to create personalized treatment plans. The conditions that bring patients to his practice reflect the limitations of symptom-only approaches, chronic fatigue and fibromyalgia, digestive disorders like irritable bowel syndrome and SIBO, hormonal imbalances including PMS, PCOS, and hypothyroidism, Hashimoto's thyroiditis and adrenal fatigue, environmental toxicity including mold exposure. These conditions share something in common. They're often complex, multifactorial, and resistant to single drug solutions. Uncovering hidden root causes in patient care. Consider depression, one of the most commonly treated conditions in modern medicine. Most primary care physicians and psychiatrists will start patients on antidepressants when depression symptoms appear. The functional medicine approach digs deeper. Before reaching for a prescription pad, Borenstein investigates potential root causes that might be driving the depression. Nutritional deficiencies like low vitamin D, magnesium, zinc, B12, or folate can all contribute to mood disorders. Hormonal imbalances such as low testosterone, thyroid dysfunction, or cortisol irregularities might be the real culprits. Gut health plays a crucial role too. Dysbiosis, leaky gut syndrome, and chronic inflammation in the digestive system can directly impact mental health through the gut-brain axis. Environmental factors matter as well. Toxicity from mycotoxins, heavy metals, or chronic infections can manifest as depression symptoms that won't respond to traditional antidepressants alone. This comprehensive approach doesn't reject medication when it's needed. Instead, it views pharmaceuticals as one tool among many rather than the only solution available. Creating sustainable wellness through lifestyle integration. The treatment protocols at Manhattan Integrative Medicine of South Florida reflect this root cause philosophy. Rather than simply prescribing medications for symptoms, Borenstein's approach addresses underlying imbalances through multiple pathways. Dietary changes form the foundation of many treatment plans. These aren't generic diet recommendations, but specific modifications designed to address nutritional deficiencies and promote optimal gut health for each individual patient. Targeted supplementation addresses identified imbalances that can't be corrected through food alone. Stress reduction techniques help patients manage the negative impact of chronic stress on their health, since sustained stress can disrupt nearly every system in the body. Lifestyle modifications extend to sleep hygiene and exercise routines tailored to each patient's condition and capabilities. Someone with chronic fatigue needs a different exercise approach than someone with metabolic dysfunction. The goal is addressing underlying imbalances in hormones, gut function, and other physiological systems rather than just suppressing the symptoms these imbalances create. Redefining the doctor-patient relationship. Perhaps the most significant difference patients notice at Manhattan Integrative Medicine of South Florida is the listening. We listen, Borenstein emphasizes. We don't dismiss. We work hard with the patient to address their issues and think and treat outside the box. This patient-centered approach starts with getting to know patients as individuals, listening to their concerns, and understanding how their symptoms impact their daily lives. These become the starting points for treatment protocols rather than afterthoughts. The appointment structure reflects this philosophy. Instead of rushed 7-minute visits focused on writing prescriptions, patients receive the time needed for comprehensive evaluation and discussion of treatment options. Borenstein's greatest sense of accomplishment comes from helping make real changes in people's lives, especially after they've been through a difficult time. This focus on transformation rather than maintenance sets functional medicine apart from conventional approaches. The growing demand for personalized healthcare. The demand for functional medicine is surging as patients seek personalized, root-cause solutions for chronic health issues. Rather than accepting a lifetime of symptom management, people want sustainable wellness that addresses why they got sick in the first place. This whole-body integrative approach identifies underlying biological imbalances to create lasting health improvements. Patients are increasingly willing to go outside their insurance networks to access this type of personalized, patient-centered care. But misconceptions persist. Many patients initially worry that functional medicine completely rejects traditional treatments or takes an anti-medication stance. The reality is more nuanced. Functional medicine works alongside traditional care, fully utilizing pharmaceuticals, surgeries, and advanced imaging when necessary. The difference lies in emphasis on root cause resolution rather than symptom suppression as the primary goal. As board-certified physicians like Borenstein demonstrate, functional medicine represents an evolution of medical practice rather than a rejection of medical science. His publications in the European Journal of Ultrasound and his role as chief investigator on spinal cord injury research projects reflect his commitment to evidence-based practice. Looking ahead, Borenstein believes functional medicine represents the future of healthcare. Patients are demanding personalized approaches that treat them as individuals rather than collections of symptoms. Manhattan Integrative Medicine of South Florida is proud to pioneer this approach as one of the few practices in South Florida offering comprehensive integrative and functional medicine care. The fibromyalgia patient who started Borenstein's journey would recognize this evolution. What began as one doctor's frustration with the limitations of conventional medicine has grown into a new model of healthcare that's changing lives throughout South Florida.